All right. I am so excited to welcome you all to Understanding Prevention for Peer Recovery Specialists with Chris Gabrielson and Chris Kelly. This presentation was prepared for the Great Lakes PTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The opinions expressed in this webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services. The PTTC believes that words matter and uses affirming language in all our activities. I want to share a few housekeeping items with you. If you have technical issues, please individually message me, Rebecca Buller, in the chat section at the bottom of your screen, and I will be happy to assist you. If captions or live transcript would be helpful, please use your Zoom toolbar near the bottom of your screen and choose live transcript. AI note taker options. Please do not activate an AI note taker application. We do not allow this for several reasons and will ask you to disengage. If you do not, we will remove you from the Zoom room. If you have questions for our speakers, please put those in the Q&A section at the bottom of your screen rather than the chat. There are a good number of people in the room, and if it's in the chat, we can sometimes lose it as it scrolls by. So please use that Q&A section for your questions. You will be directed to a short survey link at the completion of this webinar, and we would appreciate if you could fill it out. It takes just a few minutes, and it helps us improve our offerings and report to our funders. And certificates of attendance will be sent out via email to all who attended this webinar in full, and it could take up to 2 weeks to receive those certificates. And now I'm going to turn things over to our presenters, Chris Gabrielson and Chris Kelly.
Welcome. Good morning.
Good morning. Hello, welcome.
So, as we get started here, we're inviting, I see a couple people have already done this, and but feel free to post in the chat where you're tuning in from and then potentially your role in prevention. What do you see as your role um, in the uh, in the prevention field? And while you're doing that, Chris Gabrielson and I, Chris Kelly, will just do a short introduction. So I'm Chris Kelly. I'm a person with lived experience overcoming substance use challenges, and I work at the University of Wisconsin-Madison alongside the other Chris G. I primarily work on a grant called the Peer Recovery Center of Excellence. Some of you may have heard of it. Otherwise, Chris and I often get together and think about the overlap of prevention and recovery and how both fields can kind of come together and collaborate more because there's a lot of similarities in the work we do. And so we're going to explore some of that today.
Great, and I'm Chris Gabrielson. We'll have a confusing webinar here with two Chris's, both spelled even the same way, but so hopefully we'll do fine. If you have a question for this one of us specifically, you might just add our last initial in the Q&A. But I also work at the University of Wisconsin-Madison on a project called the Great Lakes Prevention Technology Transfer Center. I'm the co-director with that project. And I have worked in the primary prevention field for over 30 years. So that's been my passion. And as Chris mentioned, when we've had discussions, we'll get on and just start talking about all the wonderful ways and that we can collaborate and what can we do to work together with the fields of both recovery and primary prevention working together. So I'm thrilled to be on this webinar with you all today and to be able to talk about prevention. So
So today, our path for this session, we're going to be defining prevention. So what it is and what it isn't. This was an eye opener for me. I didn't know much about prevention prior to 2018 when I started in this role. And so I'm excited that we'll be able to share some of that with all of you. We'll talk about how we use the strategic prevention framework or the SPIF, like what that is. First time I heard of it, again, I had no idea, and then it kind of blew my mind once I learned more about it. Why and kind of what is evidence-based about prevention, and then ineffective and effective prevention strategies, and then at the end, we'll wrap it up with our call to action. This is still me?
Yeah.
Be forewarned. We're going to have some pop quizzes throughout the session, of course, as with any pop quiz. You may or may not know the responses, so just do your best as we go through today. There is no penalties for getting the wrong answer. It's just an invitation to kind of think about what may be upcoming.
All right. So as we start thinking about prevention, we often talk about moving upstream when where we're focusing our time and effort. So there are examples of prevention in many different areas of our lives, not just in this specific context. For example, I'm guessing on your computers, you have some antivirus software. Antivirus software is designed to prevent viruses from getting onto your computer. It's not to take care of them once there's a virus that's infected your computer. It's to prevent it in the first place. Similarly, lighthouses. Lighthouses are there to prevent the shipwrecks, not to take care of the ships once they have crashed and need to be repaired. It's to prevent that from happening. Similarly, sunscreen. We want to prevent sunburns, as well as immunizations. Immunizations are preventing illness from ever happening. So these are some examples of ways that we have in our society, our culture, to do some primary prevention. And that's where we're going to be focusing our time and efforts during this webinar today. So we're curious, before we get too far in, of what have been your experiences working in the primary prevention field, if any? And maybe this is something that's brand new to you, so you haven't dipped your toes into this area yet. But if you have, go ahead and put in the chat if you can. What have been your experience? What specific experiences you've had with primary prevention? You could go ahead and take a moment. Megan says she just started this past November. Great. Well, welcome, Megan. Oh, it's some more new folks. Great. Connie's new. Great. Oh, wow. We've lots of people just started. That's wonderful. And some folks have worked in prevention for a while. Great. All right. Working on a college campus. We've got different people. All right. Wonderful. It looks like a wide variety of experiences today with folks who are on here. And a lot of new folks, which is fantastic to hear that you have joined us in this work in the field. All right. Well, with that, thank you for sharing that. For those of you who are new to the field, we have a video for you that might help give you a brief orientation to what prevention is. So I'm going to go ahead and share that right now.
All of us want to keep our kids and communities safe and healthy. An important step is to learn about preventing substance use disorders and to understand that the adolescent brain is more vulnerable to alcohol and drugs than the adult brain. The earlier someone starts using substances, the greater their chances of developing a substance use disorder. 90% of those who have a substance use disorder started using drugs and alcohol before they turned 18. 90%. So what does this mean? Prevention is about delaying the onset of first use or pushing it back as long as possible. Whether alcohol, tobacco, or marijuana, the most commonly used substances among teens. Protecting the brain during this period of development is an important part of prevention. The adolescent brain is rapidly developing, learning and changing all the time. It can learn a language or a musical instrument more quickly than an adult brain, but it can also be harmed more easily. The brain continues to develop until a person is in their early to mid-20s, with the regions of the brain that keep emotions and impulses under control and help us make decisions among the last to develop. This is also why adolescents are more likely to engage in risky and impulsive behaviors, such as trying drugs and alcohol in the first place. Early use of alcohol or drugs can disrupt brain development in ways that increase a person's risk of developing an addiction later in life. Other factors that put an adolescent at risk, besides the age of first use, include caregiver substance misuse, trauma, and a lack of social attachments. These are called individual factors. And they're part of the big three in preventing addiction, along with environmental and genetic factors. Environmental factors include high drug availability, a lack of laws and enforcement, and social norms. And then there are genetic factors, which research suggests accounts for about half of a person's likelihood of developing a substance use disorder. While we can't change our genetics, knowing about a family history of addiction can help empower us to make different decisions about our substance use. For every risk factor, there is a protective factor to counterbalance it. Prevention focuses on strengthening the protective factors that we can control to decrease the likelihood that a person or a community will struggle with addiction. Together, we can solve this. Join us.
All right. So, and I see the question, oh, and in the chat, Rebecca already answered that this video is on YouTube, and you do have the PowerPoint slides. You can access them through our product page on our website. And Rebecca will probably be posting that link again. But for those of you who were registered as of yesterday, you should have received an email as well with the link to it. So hopefully that helps answer a few questions. And that, Denise, that's great that you love the video. I think it's a really nice, succinct way to give people an idea of what prevention is. So I'm glad you enjoyed it too. All right, so with that, then, of summarizing that video, so the goal of substance misuse prevention is, as it says on the slide, to put measures in place before there is a problem, so those downstream are carrying less of the public health burden. So it's that idea of, many of you have probably heard the public health parable of, going and finding, a nice place in the river that you're out enjoying the river, and then somebody's coming down the river and you're needing to save them. And then another coming down the river and you're constantly trying to save these folks. And then at a certain point it's like, okay, what's going on upriver? Let's go upriver and see what's going on as to why people are falling in and we're having to save them. So it's that idea of going upstream to take care of any problems, risks that are there in terms of, we talked about risk factors with substance misuse. What can we do to address those risk factors, enhance protective factors in order to, as it says, to prevent, be proactive so that we don't have to be saving those folks downstream. Few things then just to clarify, because this often comes up when we're trying to wrap our heads, if you aren't working in the primary prevention arena, sometimes it's like, well, which things are prevention, or what do you mean with that? So some things that are not considered substance misuse prevention when we're talking about primary prevention are things like substance use disorder treatment, recovery maintenance, and many harm reduction strategies. So again, not that these aren't important and essential, and we must have these within our system. When we're talking about the prevention piece of the pie or the puzzle, these do not fall within that. And just a few clarifications that sometimes people are wanting a little bit more distinction between primary prevention and harm reduction. The way it's easiest for my brain to kind of capture the distinction between those the two is prevention prevents the behavior. That's the focus of it. Well, with harm reduction, we're preventing the consequences. So hopefully that might help you all get a distinction in your mind in terms of for this webinar of our focus with primary prevention. So just throwing quite a bit at you in terms of what prevention is and what it is not. And I'm going to turn it over to, well, actually, before we do that, we'll jump into any questions people have before we jump into our first pop quiz. So any questions? I know with the, looks like in the Q&A, nothing, the more comments versus questions with that. So, and there is the one question, will the webinar be recorded? Yes, it's being recorded and it'll be shared on our page. Any other questions right now before you have your first pop quiz? All right, I'll turn it over to you, Chris.
All right. So in a moment, you'll see a box pop up on your screen. There we go. And you're going to respond to, for each strategy, indicate if it is a primary prevention strategy or if it falls somewhere else on the continuum of care. And so the first is strategy designed to decrease the risk factors of substance use disorder in older adults. The next one is strategy to prevent the consequences of substance use. And the third is program designed to prevent the reoccurrence of substance use disorder. So I see a lot of folks adding their responses. Thank you very much. And we'll just give it a moment here while people put in their responses. I think we're starting to slow down. And if you can see, you can kind of scroll. Well, there's 3 responses there. And I think we're just about there, Rebecca. Got a lot of folks in the room, so the polls take a little bit. We give the polls a little bit more time.
We're at 80%.
Sure. Let's should we end the poll and go through the responses? Anytime
All
you're
right,
ready.
shall I close the poll?
Sure. And we're going to share these results. So let's see, for the first one, again, we're looking at for each strategy indicate if it's primary prevention strategy or if it falls somewhere else on the continuum. The first one was strategy designed to decrease the risk factors for substance use disorder in older adults. And so we had about 76% in primary prevention and about 24% in other. And ding, 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 the correct answer is prevention. So it is, that is a primary prevention strategy. The second one is a strategy to prevent the consequences of substance use. And so we had, that one was almost split. So about 41% in primary prevention and about 59% in other. And so it is other, as Chris indicated earlier. Harm reduction is about preventing the, not preventing, but prevent the consequences that might come along with substance use. And the third one is program designed to prevent the reoccurrence of substance use disorder. And that one was split 50-50. And so the correct answer is other. So rather than that being a primary prevention technique, that's actually oftentimes kind of couched in maintenance, recovery support services. A lot of times peer recovery support services might fall into that area. And I think that's it. So well done.
Yes, thank you everyone for participating in the pop quiz. I find sometimes it's helpful to just take a moment to digest some of the information we've taken. So we're having those pauses, a few more pauses during the session today to do that. All right, so when we talk about moving upstream, I already mentioned a little bit, but the way that we can move upstream in primary prevention is to look at what risk factors exist in our community that are putting people at greater risk of substance misuse. So how can we reduce those risks? As well as also looking at how we can increase protective factors that actually buffer the impacts of risk factors. So by doing both, decreasing risk factors and increasing protective factors, this is how we move upstream. It's how we can go upstream to say, okay, what can we do before people ever start misusing substances? How can we prevent that from happening? So then it's like, well, okay, how do we figure that out? What do we do? How do we go about identifying what risk factors we need to address? How are we going to increase protective factors? We can do it through what we call a comprehensive data-driven strategic plan to reduce risk factors and enhance protective factors. This strategic plan is what creates the map for our primary prevention efforts. And the way that we can create that map is through using the strategic prevention framework. And Chris was going to go ahead and share a few thoughts around the strategic prevention framework.
Yeah, thank you. Well, when I learned about the strategic prevention framework, I really wished we had a strategic recovery framework because it's pretty cool in the way it allows different prevention communities from all around the nation to really kind of work in the same direction towards the same broad goals while also focusing locally, responding to local needs. So it's not prescriptive, but it truly is a framework. And the similarities I noticed in this work and recovery work is how we work on recovery planning, and we work in the peer recovery field, we work with recovery capital. And so when this clicked for me, when I thought about providing individual services to people and how we really focus on raising their recovery capital. And so that might be similar to raising protective factors and reducing risk factors. And so that's kind of when it piqued my interest in, like, how can we bring these two fields together? So again, as a person who's overcome substance use challenges, a lot shifted in my life, and I actually raised the protective factors like in my family environment. And I thought about that, and then I reflected on prevention as I was learning more about it and thought, wouldn't it be cool if more peers and people in recovery joined with the prevention field? Because oftentimes what we're doing in recovery, when we come into recovery, is we're kind of breaking those intergenerational cycles of addiction, and we're actually promoting intergenerational cycles of recovery. And how do we have those conversations and then bring people together to talk about that?
Great, thanks, Chris. So as we're thinking more about this, the SPIF, or the Strategic Prevention Framework, might be new to some of you folks. So we have another video for you that gives a good summary of the Strategic Prevention Framework. So I'll go ahead and switch over to that and show you that video.
The Strategic Prevention Framework, or SPIF, is built on a community-based risk and protective factors approach to prevention with a series of guiding principles that can be utilized at the federal, state, tribal, and community levels. There are 7 phases of the SPIF: assessment, capacity, planning, implementation, evaluation, cultural competence, and sustainability. Cultural competence and sustainability are at the center of every phase of the SPIF and should be considered in each aspect. The first phase of the SPIF is assessment. The SPIF is a data-driven process that answers the question, what is going on in my community? We want to assess profile and population needs, resources, and readiness to address needs and gaps. We want to assess prevention needs based on epidemiological data. And culturally, we want to make sure that we assure that the data is culturally responsive and appropriate. The next phase is capacity. Capacity is the ability to mobilize stakeholders and resources to address the needs of a community. Building prevention capacity is all about taking a look at personnel, knowledge, and skills, as well as community and organizational resources and readiness. In essence, capacity equals resources plus readiness. With regards to cultural competency, we want to make sure that we examine community resources and readiness and check cultural representation. The next phase is planning. In this phase, we want to develop a comprehensive plan which includes strategic goals, objectives, logic models, and action plans. When developing logic models and action plans, it is essential to determine who may be missing from the process and to make every effort to ensure that the plan is culturally inclusive. The next phase is implementation. In this phase, we want to implement evidence-based programs, policies, practices, and strategies. And what we want to remember about cultural competency at this phase is that interventions that are effective and appropriate for the community ensure that all stakeholders and community partners are involved and on the same page, and cultural adaptations are made as needed. Evaluation. In the evaluation phase, we want to measure the impact of the intervention and its outcomes. In this phase, we monitor, evaluate, sustain, and improve or replace those things that aren't working. The purpose of evaluation is to look for areas of improvement. With respect to cultural competence, it is important to make sure that the community is involved in all aspects of the evaluation process. Cultural competence. We want to consider cultural, gender, ability levels, and sexual orientation in all aspects of the SPIF. The reason why we do this is to eliminate service and participation disparities for people of diverse racial, ethnic, and linguistic populations. Each step of the SPIF requires and greatly benefits from the participation of diverse community partners. Sustainability. In this phase of the SPIF, we want to identify the outcomes that were achieved and consider what exactly do we want to sustain. Do we want to sustain the prevention infrastructure, partnerships, collaborations, effective policies, programs, or practices? It's important to remember that the individuals and institutions you involve will change as your initiative evolves over time, but the need for prevention partners will remain constant. Culturally, we want to remember that the levels of partnership that are most culturally relevant to the community. We want to remember that valuing diversity and awareness and acceptance of differences throughout the SPIF is really important in the sustainability phase. In conclusion, the SPIF is designed to help practitioners gather and use data to guide all prevention decisions. Communities may also engage in activities related to multiple steps simultaneously as their needs evolve. Earlier prevention models often measured success by looking at an individual's program outcomes or changes among small groups. But effective prevention means implementing multiple strategies that address risk and protective factors associated with the problems or issues in a given community. In this way, we are much more likely to create an environment that helps people support healthy decision making. And that's the SPIF.
All right. So hopefully that gave you a good overall understanding of what the SPIF is. So as a peer recovery specialist, if you're approaching some folks who are working in the primary prevention field and they start talking about, using the acronym SPIF, and you'll be like, I know what the SPIF is. Yes. So, and it is, the YouTube video link is on this PowerPoint slide. So you are welcome to watch it over and over as much as you like, or if you want to share it with other folks as well. So again, just going back to then, the reason that the prevention field uses a strategic prevention framework is to create that map to be able to effectively reduce risk factors and increase protective factors in order to move upstream into that proactive mode of preventing substance misuse before it happens. All right, Chris, any more thoughts about that before we move on to the next section?
I know we'll cover this at the end, but I just want to say it now too, that through the Prevention Technology Transfer Centers, there's lots of opportunities to engage more deeply with all things prevention, and all the offerings, the trainings are they're free. So I would say go and explore. You can just Google Prevention Technology Transfer Center, and you'll see we have 10 centers around the United States, and each one has its own learning opportunities. Rebecca just put it into the chat, but that's a great way, again, just to continue this learning and explore, because like I said, I think the recovery community, and especially the peer recovery community, has a lot to offer the prevention community, and vice versa.
Thanks, Chris. All right, so we're going to shift gears a little bit now, and looking at, so once we know what risk factors are prevalent within our community and where we really need to increase protective factors, then we start thinking about what can we do about this? What strategies can we actually implement? So what we've done within the prevention field is to really look at what research shows us is effective as well as what's not effective. And so let's talk about evidence-based strategies or programs, practices. Those terms are often used interchangeably. So we've got an official definition for you here if you want the official definition. So these are programs or practices that have one or more research studies, research valuations that show that they have been effective, so that they've done what they set out to do. So with thinking back to our slide around other examples of prevention, such as immunizations, sunscreen, antivirus software, if you think about the development of those things, it's the same kind of thing, that they start with, okay, what can we do to prevent these things from happening? Even thinking about technology with antivirus software, it's creating something, and then they had to test it to see, okay, does this software actually prevent viruses from getting onto our computer? They weren't just going to say, oh yeah, this sounds like a good idea, and here, go install it on your computer. Hope it works. Right? That doesn't happen. They test it thoroughly and they make sure that it's actually going to prevent these things. So in the similar way with substance misuse prevention, we look at, okay, we're going to try this strategy and then we're going to evaluate it and see whether or not it is effective. There we go, that moves. So when we're thinking about this, as studies are done and we are able to place these strategies on this continuum, did we find out when we did this research and we did these evaluations that, gosh, we thought it was a great idea and we really had great intentions, but we actually increased substance misuse versus decreasing it. So on that left-hand side, the harmful part, it's like, and this is, not through bad intentions that people are going out there and trying to create harm, but sometimes what we think is going to work actually can be counterproductive and actually increase use. So that's the far left end of the continuum. Of course, there's unsupported, a lot of strategies out there that have never been evaluated. Some people are just like, yeah, we want to do this for prevention, we're going to go and do it. There's no evaluation. In that case, we don't know if it's harmful or it is effective. We just don't know. So that's the unsupported and undetermined. That's kind of that area. Emerging is there's some research starting on around a strategy. The promising is, gosh, we've had some good preliminary results, and then supported is, yeah, we know we've had multiple studies that show, yes, if we implement the strategy as designed, this is a way to be proactive, to move upstream, and prevent substance misuse. And well supported. My chat bar was on that side of it, so I missed that, but well supported, as you can see, is that it's very well studied. So many studies. All right. So when we're
Chris,
thinking, go ahead,
I
Chris.
just have a relevant question, and maybe we can answer it quickly, but someone's asking where we can find evidence-based curriculums used for prevention programs.
Great question, and we will be sure to cover that because there are lots of resources out there that exist. We're going to talk about some strategies in these slides, but then we're also going to give you resources to be able to find that, because fortunately at this point with the prevention field, we actually have that set of knowledge. When I started back 30 plus years ago, we did not have this knowledge base. So we've learned a lot in the last 30 years. Great
Thank you.
question. All right, so how does some strategy become evidence-based? Well, of course, got to start out, there's got to be some innovation. There's got to be somebody starting something. They have an idea. They maybe use the theories, the human development theories that we know can help us design an effective strategy. Then they do some initial studies and then if the initial studies looks like, oh gosh, I think we're going in the right direction, this is very promising, then do the more studies, and then if it's still showing it's effective, that's when it becomes evidence-based. So that's where we really want to focus many of our efforts, as much efforts as we can in this evidence-based area, because then we can be confident that we are having a positive impact and accomplishing what we want to do.
When I just wanted to jump in for a moment and reflect on the peer field, I think sometimes what gets frustrating is, and we have to be patient with ourselves too, so that that process from innovation to evidence-based can take 10, 15 years. And so it can feel sometimes frustrating that, at least for me in the recovery field, when I started, there wasn't as much evidence around recovery support services, peer recovery support services, and that. And now we're kind of seeing what was started 10 years ago come to fruition. And we often talk about practice-based evidence. So that's a lot of the work a lot of us peers on this call are likely doing, is the practice-based evidence. So people are currently researching what we're doing. And yeah, it'll take 10 to 15 years for that to come out and someone to say, yep, this is for sure an evidence-based practice. And so I just say that to not be dismayed. And it doesn't mean that what we're doing doesn't have an impact and it's not working. It just means that, like, prevention has had kind of had a head start on the recovery field.
Yes, yes. Good point. Thank you. All right, so why do we even care about this? Why put the time and effort? Yeah, let's just go and do our good work, which absolutely, let's go and do our good work. But by doing this, first of all, it gives our work credibility, that we can say the reason why we are doing this is because evidence shows, research shows that by implementing these things, we can prevent substance misuse. So that, especially as you're looking for funding to implement things, this is really important to be able to show that what you're going to spend the money on is going to produce the impact that you want. Second of all, it increases our effectiveness. We have limited time, energy, our passion. We want to put that in a area, and our efforts, our time, in a way that we are going to have the impact that we want to have. We're all here. I'm 99.9% sure that every single person here is here because you want to prevent substance misuse. You want to prevent the harms that can happen, the challenges that happen with substance misuse. So I know I personally, in everyday work, I want to make sure that everything I'm doing is going to be effective and lead us to lead the field toward the positive impact of our work. The last piece is it helps us avoid doing things that can be counterproductive and possibly harmful. We know a lot through research about what works and what doesn't. Unfortunately, the information about what does not work is still not out across the prevention field. There are still things being done in many, many communities, if not every community across the nation, that we know are not effective and are sometimes possibly can be harmful. So it's essential that we know this information about what is effective and what is not as we're doing our prevention work. All right, so with that in mind, let's go ahead and explore some of these effective and ineffective prevention strategies. But before I get into this, I want to make sure that as I'm presenting this information, we are not presenting this, in terms of the ineffective pieces to have be shaming anybody if you are currently implementing some things. If you've done any prevention work in the field, you likely have done some of these, implemented some of these strategies because they're out there, they're prevalent. In many ways, we think this should be effective. So in our minds. So no shame, no guilt, no judgment from my part, Chris's part, hopefully none of the other fellow participants. This is a time for us we hope that you'll be open to learning about what the strategies are effective and ineffective. And Joe, I love what you said. The more we know, the better we can do it. Absolutely. That's a great summary of it. Thank you. All right. So a few things to keep in mind as we go through the next slides, that implementing effective evidence-based programs ensures us that we will do no harm. Key within prevention, of course. And if ineffective or counterproductive prevention strategies can increase the risk of drug misuse. So that's why we want to be sure to avoid that. All right, first category. Ineffective education strategies. So some things that we know through research, again, that they've done the research, they've studied these strategies to see how effective they are, and they found that they are not effective. One-time events. We know that just doing a prevention strategy, a prevention, one-time event is not going to do it. It has to be multiple, over time, integrated, comprehensive kinds of strategies in order to truly have the impact that we want to have. Some of the one-time events that often happen are assemblies. School assemblies are still really, really, really popular. It's, cost effective. It's easy to do. We can throw all the kids in the gym at the same time. We can hire one person to come in and talk. And in many ways, we think logically, well, we can just let kids know what they should not be doing and why they shouldn't be doing it. And that, especially if there's a compelling story behind it, we think that should work. We know through research that those school assemblies, in and of themselves, are not effective. Now, if it's an assembly to kick off a comprehensive strategy where there's going to be a lot of other things, maybe within the school, there's the individual classroom sessions, maybe a life skills training that happens over time, once a week for many, many weeks, those kind of things. That's something different. But if you're looking at a one-time event assembly, not effective. Another thing that, logically we think, gosh, this should be effective. But what we have not seen as effective is personal testimony from people in recovery. So somebody going and sharing their story of, how substance misuse impacted them, and, how they could their life, the impact of it on their life. We would think logically, well, kids would want to avoid doing that, right? Well, unfortunately, the adolescent brain does not work that way because, and I'm going to attest to it, I have two boys. They're now 19 and 21. But I don't know about you all with other parents here, but I was shocked the first time I heard from my son's mouth when I was like, you really shouldn't do this because if you do such and such and such, this bad thing's going to happen. I can't remember what the exact thing was, but I will never forget my son saying, well, but that would never happen to me. And it was like, okay, this is exactly what we're told. But the adolescent brain is like, well, yeah, I see that can happen to other people. And I hear your story and that happened to you. But I could do that. I can use this drug, but I'd be fine. That would never happen to me. That's that adolescent brain. The prefrontal cortex is not engaged yet. So hearing those stories, we just don't see the impact we would hope we would have in those cases. All right, another example, mock car crashes. Lots of times prom season, this is still very popular across the nation. is to, put out a mock car crash and say, gosh, if you drink and drive, this is what's going to happen. We have seen, first of all, that it doesn't have a lasting impact at all. It actually can have a negative impact in terms of trauma on kids and actually make things worse. So car crashes, well, they are very much embraced by many communities because it feels like you're doing something. Again, don't have that impact that we want to have. Drunk goggles, some people might not even know about these, but these are goggles that they put on kids and then they have them, do different things. Like they might be in the gym and be on scooters and have them go through like an obstacle course on the scooter. And it simulates what it would be like if you were drunk. Well, guess what? These kids find this very fun and think it's actually entertaining. So this is one of those counterproductive strategies that they're like, wow, gee, that's a lot of fun. That's not necessarily a bad thing to drink and drive. And the other thing is, I've also been told is all kids have to do is close one eye and then they can see just fine. So again, like, okay, if you're drunk, just close one eye and then you'll be just fine. So we definitely do not see a positive impact with the preventive impact with drunk goggles. All right. Were there any questions, Chris, that came up with this slide? I know there's been things in the chat and I haven't been able to read through. Is there anything?
Yeah, just mostly people responding with this was the curriculum they experienced in high school was all of these items. And so
Yes.
and a lot of folks in recovery saying that might be our proof within this workshop that these strategies might not be all that effective.
Yeah, and it's interesting because, I have been fortunate that I did not develop a substance use addiction. But if I went through these in school, if I just went through my own, well, gosh, it must have been effective because I never misused substances. I was very fortunate. I had few risk factors within my life, and I had quite a few protective factors. Actually, a lot of factors. I was really lucky. But so for me to judge the effectiveness of these strategies because I didn't do that, it was the other things going on in my life that were likely protective, not because I sat through an assembly that said you really shouldn't use drugs.
Right,
So
right,
yeah,
right.
so that's the danger for those folks who are not in recovery. I know there's many people who said they work in primary prevention. We have to make sure to not make those assumptions if we are coming from the other perspective.
Sure.
And for some reason, this makes me think of recently. I watched John Mulaney's stand-up comedy on Netflix. I don't know if anybody else has watched that, where he talks about the street smarts, school assemblies that he attended. Yeah, Dan, I don't know if you saw that. But he makes fun of, they had this anti-kidnapping school assemblies, essentially, that they bring this cop in to talk about it. And it's the same kind of thing. Yeah. So if you happen to watch it, apply that to substance misuse as well. Substance misuse prevention assemblies.
And then we're just getting a lot more feedback about stigma, and I think we're gonna hit on that in some of our effective strategies, but how reducing stigma so we can actually have these conversations is important too.
Essential. Absolutely. All right, so let's look at some effective education strategies. A few of these strategies include social and emotional learning curricula in school, parenting education programs that are focused on reducing risk factors and enhancing protective factors. Similarly, different curricula, either school-based curricula or other curricula that are implemented within the community for youth that reduce risk and risk factors and enhance protective factors. Again, those strategies that are delivered over time and that are age appropriate. So what we do with youth in elementary school, what we're talking about with them is going to be very different than what we talk about within middle school versus high school. If we're working with college populations, what we're talking to them about is going to be very different than what we're going to be talking to them, to the youth who are younger than that. Similar if we're looking at preventing substance misuse with older adults. that's going to look very different, obviously. So we want to make sure it's age appropriate and, of course, not a one-time event, but it's delivered over time. So similarly, long-term education, at that last bullet, long-term education campaigns with a focus, goal, and audience. So the media campaigns, different things. Sometimes we try to capture and address everybody, all the audiences we want to address with one message, and we just can't do it. It has to be a focus goal and a focused audience for that. All right, so let's turn our attention to appeals. So some ineffective appeals. These are probably no surprise to you all, but fear-based campaigns, that's even started. How many of you remember the "This is your brain on drugs" with the frying pan? I'm guessing many of you remember that. Um, so although that doesn't, that's not on TV anymore, or there are streaming apps. We still tend to go to fear-based campaigns. Scare the health into people. We know, not only with substance misuse prevention, but all other kinds of, you got to start exercising. We can't scare the health into people. Using grotesque images, again, this is still very appealing for folks. There was recently a meth campaign, a meth prevention campaign by one of the states. I won't say it's not in the Great Lakes region, outside of the Great Lakes region, but they use these grotesque images of, and again, if we're focused on youth in particular, that's when in their brains it's, well, that would never be me, even though it could be. I mean, even if the images are realistic in terms of what can actually happen, the adolescent brain, it can't compute that could be them.
Well, Chris, in addition to that, this just came up at a recovery summit I attended, and also for people who are struggling, those images say, "This is what the world thinks of me." So
Oh,
how can I step out of this and ask for some help or get help if I am literally a fear tactic? That just increases the amount of stigma on people who are struggling with substance use and have substance use challenges. And so it's on both sides. It doesn't work in prevention, and it certainly is horrible for people in recovery who see those images and say, well, this is what the world thinks of me.
That is an excellent point. Absolutely. Yes. So yeah, we're not only doing harm on the prevention side of things, but we're also doing harm on the recovery side and getting people in recovery. Absolutely. Great point. Thank you. Long-term consequences, again, especially with youth, even with adults, though, if we're talking about, if you do this, 20, 30 years from now, if you smoke right now, 20, 30 years from now, you're going to get lung cancer. Yeah, that's not gonna have the impact we want. It's being able to think about the actions that I have today. What's going to happen to me today is really where youth are at, as well as adults. I have to say, even myself. Exaggerated dangers, again, probably no brainer, but it's, if we have exaggerated dangers around substance misuse, then kids are going to write us off. They're like, gosh, they're just they're just feeding us lies now, and they're going to completely tune out of any prevention work we're doing. And moralistic appeals, again, that is not going to feed into the adolescent brain. All right, let's look at some effective appeals. So a few things, I have some images here of some examples of ways that we can do some effective appeals. One is the normative messages regarding peer use and action. So these are some examples on the screen saying 4 out of 5 Panthers do not drink alcohol, join the crowd. So of course, most kids want to be part of the majority of the crowd. They don't want to stick out. They don't want to stand out. They want to be part of the majority. So having appeals where it's like, if you don't do this, you're going to be part of the majority of the folks. So those kind of appeals we have found to be effective with prevention. Focusing on short-term impacts of use. So instead of with smoking, so saying 20, 30 years from now, you're going to have lung cancer, it's gosh, you're going to have really bad smelling breath. Nobody's going to want to kiss you. You know, your clothes are going to smell. Those kind of things, that those short-term impacts are going to have much more of an impact. And again, similarly in terms of the normative message, but of the positive effects of no use. So like that example, the image on the right-hand slide, you know, I make my own choices. I like not drinking. You know, these are the positive things that happen when I don't use. All right, Chris, any additional thoughts around appeals?
I just think it could also, again, when I translate this to recovery work, we often do some of this in our recovery planning, and we use like a decisional balance scale. And so the pros of behavior, the cons of behavior, and we help people weigh things out. And so when I think of positive effects of no use, we're having those conversations when we're doing recovery planning. And so again, just to help peers kind of wrap their head around and say, we know a lot of this stuff, it's just being used in a different way within prevention. And then we did have a question, you might get to this, Chris, but do we touch on one-time DARE programs?
So that the DARE program is an example of one that has been studied and shown to not be effective.
Okay.
So that's where it's usually done over time. So that's not the part of the challenge. It's been the other components of it that they have not shown it to be effective. Now there's a new iteration of the DARE curriculum. I'm not thinking of it's a different name, where they've shown some effectiveness, and that's one where there's been some mixed results with that one.
Okay. Thank you.
Mm-hmm. All right. So last category that we're going to look at is information sharing. So some ineffective things that we found that we've tried within substance misuse prevention are strictly knowledge-based interventions. And again, these are things that are still happening now that we want to try to move away from as much as possible, if not completely. I would hope at some point we can move completely away from them. But again, just sharing, okay, this drug does these kind of things, so you shouldn't use it. What we find is we have better educated drug users. You know, people, the kids are like, oh, that drug is in my grandma's medicine cabinet. I could use that, and I could get this impact. Or you know, or I know how to get this. Or gosh, that would happen. I'd like to try that. So definitely, you know, I remember talking with one community, and they had what are those, the metal, you know, like the circle metal things where you can hang note cards on it and flip things through, that they had, you know, a drug on one side, and then on the other side were the effects of the drug, and they would give those to kids to look through. I go like, and you know, I remember back when I started, there were actually literally boards where people would have the different drugs on there to take into classrooms. Please don't do that. If you're doing that, if you know in your community you're doing that, this is one of those that actually is counterproductive and can increase the risk of use. The last thing I wanted to talk about with ineffective information sharing is myth busting. And this was something that until I worked with somebody else to put this presentation together a little while ago, I did not know about this. That by doing the myth and then the truth, what happens in our brain is that we tend to remember the myth versus the truth, because it's reinforcing. The myth is out there, we once again reinforce what that is, and then we share the truth. But in our brain, and again, this is one of those where they've done a lot of research around that, we don't remember the truth, we remember the myth. And this is not just with substance misuse prevention, this is in general how our brains are working. So really staying away from myth busting as a strategy for our work.
And again, this rings true in the recovery field. We know that just giving people information is not effective. That oftentimes it's about helping people touch into their own reasonings, doing a lot of validating how they're feeling, And again, doing that kind of coming alongside, partnering with people, giving them resources and options. But just giving people information is rarely a effective strategy, because oftentimes we're telling them things they already know, and then they're kind of maybe distrustful of us and saying, well, you didn't even take the time to get to know me, you're just telling me things I already know. So one question, Chris, on this is, does the effectiveness change depending on whether a student is self-selecting versus being forced to attend? So I don't know if you know that.
That's a great question. And I would say that it would not make a difference in terms of these strategies. I think that what they've found with these studies is that these are not mechanisms through which the preventive effects impact. So I think that that would not make a difference between if kids self-select into it.
And then do you know if there's another question, I think this is what they're asking, if information sharing, is it effective towards parents versus the kids?
That's a great question. I know there are different strategies out there to share, like with parents of, what to look for to see if your kid is misusing substances. That, might be helpful just to help with the like an early intervention aspect. But again, with parents, where we're seeing the effective strategies happen with them is to help increase the parenting skills. So in terms of like family management skills, being able to talk with your kids effectively about substances and the impact of misusing them. So that it's really more skill building kind of things that need to happen. Um, is there a time and place where some information might be useful? Yeah, probably, possibly, but would I want to put all my eggs in that basket for a preventive strategy working with parents? I wouldn't. I would have that like be a component. All right. And no other questions at the moment, Chris?
No, I think we were covering them as they come in. Thank you.
Great. All right, so let's look at the effective information sharing piece. So actually, we just kind of talked about that in the answering that question. So if it's part of education related to how are we going to reduce risk factors and increasing protective factors, that can be a positive impact in terms of information sharing. And the second bullet there, focus on actions one can take to apply the educational materials. So again, there could be some information, but what do we do with that information? It's, again, similar to anything, even like with this webinar, we're giving you a lot of information, but we are going to move into what do we do about it? How are we going to use it to take those action steps? All right. Question earlier of where can we find information around evidence-based prevention strategies? I highly recommend that you download this guide to online registries for substance misuse prevention evidence-based programs and practices. This was created by the Region 9 PTTC, the Pacific Southwest Prevention Technology Transfer Center. In this guide, it has the different websites that exist, these online registries, and what kind of criteria you can search through these registries to find information around evidence-based strategies, prevention strategies. So if you're looking for that information, highly recommend you download this guide and explore the different websites that are within it. All right, so any other questions that have come up at this point, Chris?
Nothing new, so maybe we'll
Okay.
just see if anybody has a last minute question before we move on. Not seeing anything, and we can always circle back to it at the end as well.
Okay, I'll hand it over to you for the next pop quiz.
All right, here we go again. Pop quiz on what examples of an ineffective education appeals or information sharing or marketing that you have seen. So we're curious.
Oh, you know what? I
Oh,
jumped ahead.
sorry.
I'm sorry, I jumped ahead a slide, so I put up the pop quiz. Is that okay?
Oh, yeah, yeah, yeah.
Yeah,
Sorry.
then we'll
We'll
back
just
up.
back
I was
up.
a little too quick here.
No, they're already answering. So,
Okay.
um, yes. So I'll read it. So for each strategy, indicate if it has been shown through research to be effective or ineffective. So the first one is school assemblies to reinforce messages of the negative impact of drugs. And then number 2 is personal testimony from people in recovery. And again, we're saying effective or ineffective. Number 3 is social norms marketing. Number 4 is social and emotional learning curricula. And number 5 is mock car crashes to show the impact of drinking and driving. So just to be sure, you can kind of scroll through your screen, and there are 5 questions there where you're responding to the whether an intervention is effective or ineffective. And I'm not sure, while people are finishing up, Chris, there was a question in the Q&A about where can we find info or research on how assemblies and testimonials are not effective. So I've gotten that a couple times, is how do people find information about things, research that says, hey, these things are ineffective?
You know what? And I'm looking through, I didn't include in the follow-up email, I will include a link to a document that was created by Washington State on what works and what doesn't in prevention. And that gives you citations on different things. So you'll be able to use that. And just to let you know, we also are, that document's a little bit out of date. So I've been working with a consultant to do a new lit review on what does not work in prevention. So we will, I'm hoping that will be done within about a month. So that's going to be a whole nother document that will have much more citations than the Washington State one does, because we've gotten this exact question of, can you give us the exact studies and much more information so we can take that information to folks. So I don't have that quite yet. I wish I did
Yeah.
right now, but if you can hang tight for about another month or so, we will get that up on our website, as well as we'll post it in our social media in different ways. So, but we
Perfect.
will, in the meantime, we'll, in our follow-up email, we'll include a link to that document from Washington State.
Yeah, yeah. Well, and another person was talking about coming into this field, and so just to say to them that their name isn't listed, that we'll be talking in the end, kind of in the call to action portion, like, hey, what do we do now that we have this new information in our brains? It looks like the pop quiz is wrapping up. We got a lot of good responses, and so we can end that poll. And let's share those results. And let's see. So for school assemblies, I think we did a good job there, Chris, telling people those are not effective or they're ineffective. So 80% of our audience agreed those are ineffective. Personal testimony from people in recovery, again, about 62% said ineffective, 38 effective. The correct answer is ineffective. Social norms marketing, that is effective. So about 64% of our audience said agreed, and about 36% said ineffective, but it is effective. And the last one was the social emotional learning curricula, and almost everybody got that. It is effective. We know that works. Sorry, and there was one more, the mock car crashes. And so most of our audience agreed that about 80%, that is an ineffective intervention.
All right, well done, everybody. This is something I know it's new information for many of you, so I just encourage you, as you're moving forward with looking at working in primary prevention, that to take a look back through the website, through the slides. We will have the recording if you want to look back at this. I wanted to let you know we also do have an online course on healthy knowledge, healthyknowledge.org. on what does not work in prevention. So if you're interested in learning some more details, that's another way for you to get information around what does not work in prevention. All right, so let's go ahead and talk about moving forward. So as Chris was just mentioning, let's look at, if you are interested in learning more and wanting to move more into the primary prevention field, what can be done? One place of resource for you all is on our website. We have what we call our prevention learning portal. And with this prevention learning portal, as you click on each of these tiles, you will get to a page that on each page, it has a what is it? So on that topic, what is it? How can you learn about it? And how do you take action on it? So with our page on what does not work in prevention, this is a screenshot of what's on there in terms of learning what it is. Oh, and actually right there, that first, what is it? This brief, if you go right there, this is the document that I was just mentioning. We'll still provide a link in the email, but that's that document from Washington State. And then here's the webinar that we have done previously on what does not work. Here's the link to the self-paced online course. And then there's also in the take action, we created a what does not work in prevention slide deck that you can download to share with others about what you learned with what does not work. And it has in the PowerPoint slides, there's facilitator notes that give you information about what information you can share on each slide. So that's an example of a slide. So one of these, so if you clicked on the what does not work right here, that's what will get you to that page from our prevention learning portal. So that's one place where you can get more information about primary prevention. Another place, as I mentioned, is the Healthy Knowledge website. This is healthyknowledge.org. This is free self-paced online courses where you can earn certificates of participation. There's over 50 courses on prevention right now on there. So if you're wanting to learn about prevention, there's all kinds of topics covered in on Healthy Knowledge. So great resource for you all. Another resource that we have on our website is the Beginning Your Journey, Essential Resources for New Prevention Practitioners. And this is a place where we try to pull in some core information around what new prevention practitioners might want to learn more about. So that's a document you can download, and then there are links to resources to get that more information. Another thing, if you're wanting to learn more about the Strategic Prevention Framework, the SPIF, we have what's called the SAPS training. So if you're new to prevention, you will probably hear SAPS it's another acronym that's thrown around a lot. This is a course called the SPIF Application for Prevention Success. It's a 4-day course. And this is where you can learn how to actually implement the SPIF, as well as some other core prevention concepts. So this is something that it's done either in person or virtually. We offer it a few times a year virtually, but you can also check with your state that lots of states implement in-person SAPs as well as virtual SAPs. So that's another great option for you if you want to really dive deeper in really understanding how to do strategic planning within the prevention field. And Megan said you're going to take it soon. That's great. That's fantastic. All right. And if you're curious about becoming a certified prevention specialist, there is this map on the National Prevention Technology Transfer Center website where you can click on your state and find out more about becoming a certified prevention specialist. And yeah, I've just put Joe asked, is this the new name for the SAPS training? Yes, the acronym, we kept the acronym the same, but we changed what we was. It used to be the Substance Abuse Prevention Specialist training, a skills training, excuse me. That was what I just said was when we first developed it back in 1999, that was that one. It's been through many iterations. So yes, that's the new name for it. Sorry, backtrack. If you are interested in becoming a prevention specialist, certified prevention specialist, highly recommend you go to this website to learn more about your state. And with that, I'm going to turn it over to Chris.
Perfect, thank you. Well, and for anyone working, I had one question about kind of where to get started in maybe the recovery field. And there are lots of recovery community organizations and recovery community centers around the United States. So we have about 250 right now. Those are great resources just to look up and engage with. A lot of times they accept volunteers. They a lot of times offer peer recovery specialist trainings. Just kind of that was my entry into the recovery field. I had lived experience, but I worked in restaurants, and I was like, oh, I want to change my line of work, and I'm really interested in doing work in this field, but I wasn't interested in being a clinician. And so I found a recovery community organization, and they really launched my career in ways I couldn't have imagined because I didn't know these entities existed. So I think that's a great place to start if you're really looking for, like, where do I go and learn more about this recovery field? And then certainly the Peer Recovery Center of Excellence website. So we're a training and technical assistance center similar to the PTTC, which is hosting this event. And you can go to the Peer Recovery Center of Excellence website and learn a lot more about peer support, where to get started. There's different learning communities you can join. And again, that all comes at no cost. And so those are some places. And if I was a peer recovery specialist wanting to get started, potentially working in the prevention field or at least collaborating, a lot of prevention communities have coalitions that you can join. So reach out, kind of do some Googling and figure out who's doing this work in your state and say, how can I support your work? I want to learn more. And I think there's a lot of crossover between our fields, and we're all going to do better when we come together.
Right. Yeah, and the next slide I'm gonna share, I will have some more opportunities to, if you want to join in more of our trainings, the Prevention Technology Transfer Center trainings. I'm gonna highlight a few of those in the next slide. But before that, there are a few questions I want to make sure we get to. One, Leah says, Chris K, you mentioned a decisional balance that you use. Can you say what it is called again?
Yeah, if you just Google decisional balance, it'll pop up in your Google search, and it's a tool used often in recovery planning, and it kind of stems out of motivational interviewing. So it's like the pros of change, the cons of change, the pros of no change, the cons of no change. And so you create a grid for people and you fill in the boxes, and it helps us explore everything when somebody's feeling really ambivalent about making a decision. It helps explore all the options there and helps them come to a place where they feel like maybe I can make a decision about this because I see all the information out in front of me.
Okay, great. Thank you. And Lauren asked, how do schools implement emotional intelligence curriculum? I'm guessing you're referring to the social and emotional learning curricula. There are actual curricula that are designed for schools to implement. So they follow those curricula and they get trained in how to implement them. So there's actual materials that are designed and that schools then take and implement it. Hopefully I answered your question. If not, let me know. Put another question in. Robert says, is there a universal prevention strategy that works for everyone? Because what works for one may not work for the other. Absolutely. You're absolutely right. I would say there's not one thing that's going to cover everybody. We actually have a distinction within the prevention field of universal, selective, and indicated strategies or interventions. And universal ones are designed to impact a whole community. Selective ones are designed to impact those who are in environments that are at greater risk. And indicated strategies are for those experiencing some actual high-risk behaviors, that they've had high-risk behaviors. So ideally within our comprehensive prevention strategies, we're going to have strategies that are for all three of those audiences, all three of those types. So great point, Robert. How do we help educate our employers? So Jacqueline, are you talking about how do we educate them about what does not work? I'm wondering if you could just provide a little bit more. I'm not sure where to go with that. So just give me a little more information, then I will come back to that. Do you need to have lived experience to become a certified prevention specialist? No, you don't. That's not necessary for the certification for prevention specialist. Sheena says, can you tell me again the different places I can learn more as a peer support specialist? Chris?
Sure, I put the link to the Peer Recovery Center of Excellence into the chat. On that website, first, you'll see lots of different classes and opportunities to that you can engage in. And if you're looking for a recovery community organization in your state, we have a directory. And so you'd go to the site, go down to I think it's if you on the left side, the sidebar, go to resources, and then you'll see an RCO directory link, and that lists most of the recovery community organizations around the nation.
Great, thanks. And Nicole's looking for wanting the link again.
I'll
Chris,
just
do you mind putting that?
recopy it into the chat.
Great.
I
All right.
captured those links and I'm also sending them in a follow-up email. So don't worry if you don't catch it.
Great,
Yeah.
thank you, Rebecca. All right, and then Deborah asks, are life mazes proven to be effective? I'm not familiar with life mazes. Chris, are you?
No.
Yeah, I'm sorry, I'm not familiar with that. Deborah, I would recommend searching on the online registries to see if it's included within any of those online registries. But that's something I'm not familiar with. I'm sorry. All right, and one last question, and then we're going to wrap this up. What age do you think is appropriate to start prevention if child is considered high risk based on environment? Ideally, prevention starts prenatally. So when we're looking at doing comprehensive primary prevention, we're looking at in utero, what can we do to initially reduce risks and increase protection all the way up through older adult primary substance misuse prevention. So starting early, it's what messages are age appropriate. So in preschool, we're looking at things that how do you treat your body? How do you keep it healthy? How are those kind of things, as well as again reducing the number of risk factors that a child is in, the environment it's in during that age, as well as increasing protection. So ideally starts at conception. It would be ideal. All right, and then Jacqueline, thank you for clarifying. She says my employer informed effective strategies. Oh yeah, well, that could be tricky. You're like managing up, right? That's a tricky thing to do. You can start with, gosh, I saw this really interesting webinar. I wonder if you might be interested in looking at the slides, or, can I share a couple things that I learned about it? I don't know. Chris, do you have some other thoughts of?
Yeah, I mean, I tend to, if I need to convince someone of something, and maybe I'm not the best person to approach them because of our hierarchy, I find someone in their sphere that I can talk to that might feed them the information. Somebody
Good idea.
supportive and not calling anyone out, but calling someone into a bigger conversation. And so they don't feel shamed, but they feel informed. Yeah.
Love that.
Yeah. And I
Right.
did put into the chat, I just labeled it intersection series. So gosh, this was probably a couple years ago now, Chris, then when we did a series on the intersection of prevention, recovery, and harm reduction. And we created some toolkits on doing some gathering of preventionists, harm reductionists, and recoveryists. So there's lots of resources there as well if you wanted to do any of this work in your local community, host a webinar. We literally have a toolkit that walks you through the process. And so we'll include that link in the email that comes out as well.
Great. All right. Well, I'm going to share a few things that are up on our website that people can register to attend. If you're looking for some more primary prevention training, we have the loneliness epidemic is what we're going to talk about on July 16th, that U.S. Surgeon General report. We're going to look at the impact of social connectedness on our health and well-being. I know I saw somebody works on college campuses. I remember in the introduction. So if you haven't yet and you work on a higher education campus, I encourage you to sign up for a webinar on August 7th. August 29th, that's the 3-hour training. So that's more of skill building training on effective group facilitation skills for substance misuse prevention professionals. If you work in an environment where you're having to report back on your work with the CSAP strategies, the 6 CSAP strategies, you might look at our webinar on September 5th and possibly register for that. September 12th, we're going to take a deep dive into environmental prevention strategies. So what things can we do to impact the environment in which our communities exist? And last but not least, if you are thinking of becoming a certified prevention professional, I highly recommend that you join us on September 19th. Nicole Augustine is going to talk about preparing for the ICNRC prevention certification exam. So looking at some test taking strategies with that. So those are a few things coming up with the PTTC. If you are a social media kind of person, you're on LinkedIn and or Facebook, I invite you to like and follow us. If you would like to get updates, we will post every day at work days, things that are new or essential resources that you might be interested in. So encourage you to follow along with us on those platforms. Last but not least, as Rebecca mentioned at the beginning, if you could please complete the evaluation form that you'll be redirected to once we close out the webinar, that would be great. I want you to know that I read every single comment that's written, so it doesn't go into some black hole and nobody ever sees it. I do look through all of them to help inform the future trainings that we provide. With that, Chris, any last thoughts before we log off?
Well, just thank you. Thank you for spending this time with us and being curious. We didn't know how many people would be interested in a session like this, but obviously there's a lot of interest. So it tells us we should keep doing events like this, which I'm totally thrilled about.
Great. Yes.
And the last thing I'll say is you will get certificates. For those who've attended the webinar in full, I'll follow up with those and they come in your email inbox within 2 weeks. And you'll all get a follow-up email, as I said, with a lot of these links and a reminder about certificates. I'm going to have to close us out very shortly.
All right. Thank you, Rebecca, for being on the back end and helping us out. And Chris, thank you so much for partnering with me on this event. And thank you to you all for your time of being here, your interest in this topic. Greatly appreciate it. Hope you have a fantastic rest of your day. Bye-bye.
Bye. Thank you.